light of the present health care bill, I stand in support of it. And I stand because health care didn't start in the year 2010. It started many years before. And there have been recognition of those problems many years before now. But now we finally have an attempt at a bill, at a law. And my question is, rather than fight the law and try to repeal it, why don't we mobilize the brain power of America and try to improve what we have so that we can move it forward, rather than spend a lot of dollars fighting among each other, causing lots of partisan divide in the United States. It looks like that we can fix it. We have surgeons and doctors who fix things all the time. Why don't we try to fix the bill rather than try to repeal and start all over and costing more time and money? You have a great mind, you have great ideas, why don't we bring them together rather than you kicking you down and kicking me down and start all over? We'll never come together as a country if we don't start working together now. Thank you, sir.
I appreciate the gentleman. I would like to harken back to last August when we held health care hearings all across the country. And we asked, and the President said, there will be openness in hearings. All 80 Republican ideas were slam dunked, and Mrs. Slaughter, the chairman of the Rules Committee, was gleeful. I have the tape. Gleeful that every Republican idea was, as she said, slam dunked. That is, it has to start with some benevolence from leaders who were in power and entrusted with that power. The Speaker of the House was not the least bit interested, and the President of the United States knew exactly what he was doing when he allowed Republicans to come to the White House, debate these ideas, and then said, we won, you lost, you bad. Gentleman's recognized.
Quite simply, this country cannot afford this bill. Social Security has an unfunded liability of $7 trillion. Medicare's unfunded liability is $35 trillion. And you asked earlier, do we have confidence in Congress? The same Congress that gave us Fannie Mae, Freddie Mac, UPS, Social Security, and these unfunded liabilities, Medicare, absolutely no confidence in Congress. You cannot afford European-style entitlements and maintain a world-class superpower military and then have almost half of voting Americans not paying a dime in income taxes. Right now, we have the top 1% paying 40% of all income taxes. And the Democrats in Washington believe they're not paying their fair share. They want to share the wealth. So, my question to you is, I keep hearing that 53% oppose the bill, 43% support the bill. Who, pray tell, are the 43%? And be specific.
Well, I saw the numbers tonight on the TV before I came here. And I saw that about 90%, 78% of Democrats or so, 70-some% of Democrats support the bill. 90% of Republicans are against the bill. 66% of independents are opposed to the bill. The bottom line is that there are people who I believe are taking a wait-and-see attitude about really how this plays out, and we're learning more and more every day. As best I can tell you, I have studied the bill very carefully, and my observation is this. This bill is as much about health care as the stimulus was about jobs. It is to inflict as much damage for the purpose of killing the free enterprise system and to inflict damage upon the free enterprise system. And so they've been very good at that. I appreciate the gentleman. The gentlewoman's recognized.
I'm a nurse practitioner as well as the owner of a wellness company. So I'd like to make a statement and pose a question. I was at a debriefing today for a consulting firm that works with major employers in the Metroplex in the country with some debriefing of what this was going to mean to them. I started taking notes because the one point that really stood out for me was that a family of four making an income of around $90,000, their part of payment for health care would be about $21,000. If it was pre-taxed, it might be around 15 or 16. In a major company, the employer pays for a large part of that. If that individual is not with a major company, a young family making $90,000 might have a $21,000 insurance payment. It blew me away. That's the statement I wanted to make because I heard around the room that it's not that big of a deal. As the owner of a wellness company, I see day in and day out the correlation between a weight issue and our health, between getting out and walking, cutting back on smoking. In the year 2030, USA Today reports that 100% of this country will have weight issues. 75% of the current workforce is overweight. Are there any things in this healthcare plan promoting wellness? I really feel like the healthcare plan is null and void because people are getting so much sicker in this country, nobody's going to be able to afford it.
Thank you very much. I'm going to answer this very quickly. In my opinion, the advantages are incentives. And in this country, we incent people or we aim at what we want them to do. In my opinion, there are no incentives because we're going to have a one-size-fits-all. And except if you want to extend your own life, you can do that. Otherwise, it will be to your demise because the government will make that determination about what they're going to cover. So at some point, perhaps there will be one afraid of what the government would do to you if you get sick. I appreciate the gentleman.